Thank you, Chris, and again, thank you, members of the media, for joining us today. We have quite a bit of information to get through before we get to your questions, so we'll try to do that as quick as possible. As always, we'll start off with numbers. As of this morning, Northern Light Health entities are taking care of 70 individuals as inpatients across our system who are positive for COVID-19. 11 are at A.R. Gould Hospital, 1 at Blue Hill Hospital, 1 at C.A. Dean Hospital, 34 at Eastern Maine Medical Center, 5 at Inland Hospital, 4 at Maine Coast Hospital, 3 at Mayo Hospital, 8 at Mercy Hospital, and 3 at Sebasticook Valley Hospital. In addition, we are caring for 16 individuals through our home care and hospice at their homes. Our 2-week positivity rate is now 16.92%, with our 1-week positivity rate of 16.14%. That is slightly lower than what we've talked about the last 2 weeks, but still an incredibly high number. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalization and severe illness. As we've noted before, this graphic represents a snapshot in time, and the data is constantly changing. The graphic, which includes data compiled overnight, will be shared in the chat. And now I'll turn it over to Paul to give a brief update on staffing.
Thanks, Dr. Jarvis. And so first and foremost, wanted to thank those who have come forward to volunteer in our hospitals and in the various volunteer roles that we have available, as well as the support we're receiving from the National Guard in terms of supporting troops at our monoclonal antibody clinics. We're certainly delighted to have them and welcome them. Our staff continue to amaze us all. We continue to reinforce among our staff as well as our communities to mask when out in the community. We're finding that community exposures are really one of the greatest risks in terms of the safety and wellness to our staff right now related to the COVID pandemic. And so that continues to be what we reinforce with our employees. Just last week, we had 36 employees become positive through community exposures in social settings. And so these holiday times are a very critical point for us to bond with our families and loved ones, but also do so in a safe way. And so that's my reminder today. Thank you.
Thank you, Paul. On Friday, Maine reported its first case of the Omicron COVID-19 variant in Maine. Since then, we've been asked what this means for our healthcare system and if our advice to our communities has changed. Northern Light Health does not test for specific variants, but we know that Omicron is here, and we know that it will eventually become the dominant strain in Maine if it hasn't already. Clinically speaking, the treatments that we use for COVID-19 are the same for all variants. The same tools that we've been using throughout the pandemic apply here. The one difference is in regard to the monoclonal antibody treatment. The Omicron variant appears to be responsive to only one of the 3 monoclonal antibodies available for use. What concerns us most about the Omicron is how easily it spreads and how this may impact hospitals and healthcare systems that are already incredibly strained. Last week, we saw that Omicron strain accounted for 73% of the COVID-19 infections in the United States, and it is only a matter of time before it becomes the dominant strain here in Maine. There are mixed reports about the severity of disease that Omicron causes compared to the Delta variant, and it is still too early to tell what the impact will likely be. What we do know is that if it spreads more easily, more people are likely to be sick, effective treatments are more limited, and this may increase the strain on hospitals even more. The biggest thing that vaccinated individuals can do to help is to get a booster if they haven't already. The booster has been shown to be effective in reducing severe illness and hospitalization from the Omicron variant. If you've considered the booster but haven't had a chance to get it done, now is a good time to schedule that appointment. And of course, it's not too late for anyone who has not yet been vaccinated to start their vaccine series. There is good news news to share on the booster front. The drive to provide boosters to as many people as possible before the holidays has been a success. As of yesterday, the clinic at Maine Mall in South Portland has given more than 6,500 booster doses since it opened early last week. The clinic on Union Street in Bangor has given 785 doses, and our Northern Light Pharmacy locations have administered 657 doses over that time span. That's a lot of people boosted in just more than a week. There's still plenty of opportunities to get a booster. The South Portland Clinic is open this afternoon from 1 to 7 p.m. for booster shots, and no appointment is needed. Details are still being finalized, but we are expecting to extend this clinic through January. We'll have more information to share in coming days. Appointments are available at Northern Light Pharmacy locations and at many of our healthcare centers across the state. Visit our website to view all of the locations and to make an appointment. Since we provided our first vaccine, we've said that we'll maintain our vaccination effort until every Mainer who wants a vaccine or booster shot gets one. We're proud that Northern Light Health has provided more than 35,000 COVID-19 vaccines since we first began vaccinating. We'll continue to monitor the demand for boosters and do whatever is necessary to ensure that vaccine is easy to access. As the holidays approach, we continue to get questions about how to navigate this season's festivities in a way that doesn't put individuals and families at risk. Here are a few of the most common questions and answers to consider as you're making final plans. What can we do to make our holiday gathering safer? Most importantly, anyone who is feeling sick should stay home. It is also important to protect the most vulnerable, older family members and those with health issues, especially if they are unvaccinated. You may choose to include these folks via Zoom or another technology platform to ensure they can participate while keeping them safe. Have everyone wear a mask until it's time to eat. Try to add extra room at the table so everyone can have adequate space, aiming to be 6 feet apart, and consider opening a window to promote ventilation while eating. Seat households together for the meal to minimize the risk of family members. Make sure that everyone in attendance washes or sanitizes their hands frequently. Is it too late to get a test? Many pharmacy and hospital testing sites are booking out past Christmas. At this point, an at-home rapid test may be the best option. Supplies of these have been limited, and they can be hard to find. But if you can find one at the last minute, testing can provide information about you and your risk of spreading COVID-19. What if I was exposed to COVID-19 but I'm feeling fine? Will I put others at risk if I attend a holiday gathering? If you're fully vaccinated, feeling fine, and tested negative 5 to 7 days after exposure, your risk for spreading COVID-19 is low. If you've tested positive for COVID-19, according to current guidelines, you should not attend gatherings until 10 days have elapsed. Attend by Zoom, FaceTime, or Skype, make special meal at home, and know that your decision to stay home could help others from serious illness. As we see increases in cases of COVID-19, influenza, and other respiratory illnesses, we see increased needs for hospitalization. This is adding to an already stretched healthcare system in Maine. A few weeks ago, the large healthcare systems in the state said this is crunch time, and we asked for assistance from the community to limit the spread of these illnesses. Now we are just trying to remain in the game. Every day, individuals who need a hospital bed are boarding in our emergency rooms. Some of them need a higher level of care than what can be provided at the hospital where they are boarding. Our medical centers are doing what they can to safely accept these patients, but too often they are waiting hours, days, or even weeks. If we don't all take this seriously and do everything we can to limit the spread, someone may die because the right bed in the right place at the right time is not available. That someone may be someone you work with, someone next door to you, someone you love, or it may be you. For nearly 22 months since we prepared for the first COVID surge, and for a year since life-saving vaccines have been available, we have informed, asked, and pleaded for everyone in Maine to do the things we know can help stop this pandemic. Wear a mask when in public. Wash your hands frequently. Stay home when you are not feeling well. And get vaccinated. Our healthcare workers and first responders are tired. We are tired of seeing people needlessly get sick and die from this disease. We remain steadfast in our service to our communities, but we have a limit to our ability to do so. So one more time, I ask for your support of us. There is time to help, but that time grows shorter with each new case, each new variant, and each day collectively we do not take responsibility for protecting our families and our communities. Please, if you have not yet done so, get vaccinated. If you are eligible for a booster shot, get one. If you are in a public setting, wear a mask. If you are ill, stay home. We need you now more than ever because you want us to be here when you need us. And with that, we'll open it up for questions.
Thank you very much, Dr. Jarvis. We're going to start with Owen Kingsley from WABI. Owen, as soon as you see that you're available to unmute, please do so. That's going to take me a second to find you. There you are. You should have the ability now, Owen.
Chris, thank you. Dr. Jarvis, could you just start by giving us maybe a little more detail about the federal ambulance teams that are coming to Maine hospitals? What kind of immediate difference are these going to make in Maine hospitals?
So all of the details are not completely known at this point. Some things that we feel will be beneficial to us is one, adding to our already crucial ability to transport patients from one location to another, particularly if they need to get to a level of care that's necessary for them. And then the ability of some of these individuals to actually help and work in our emergency departments where they'll be stationed at. And so those are welcomed additions to our system, and we look forward to the collaboration that we'll be able to do with that assistance. And over time, we'll be able to report what specific duties those individuals will be able to perform for us.
Thank you, Dr. Jarvis. One other question. I believe this was yesterday. Researchers with the University of Virginia believe that the influenza vaccine this year is not showing to be as effective as most years in the past. I know that we keep talking and anticipating the holiday numbers of COVID that may be on the rise in the coming weeks. How does the possibility of influenza hospitalizations go into, or how do you believe that it'll impact healthcare workers and the current state of hospitals keeping up with COVID-19 patients?
Yeah, I don't think it's a possibility anymore. The number of cases of influenza A has been increasing now for the last week and a half, and so we know that influenza is out in our communities. It just adds one more thing that is out there that can result in people requiring hospitalization, and unfortunately we know influenza is a deadly virus as well, and so it just adds to that particular strain. Despite that there is some evidence that maybe the match for the influenza vaccine to this particular influenza that's circulating might not be perfect, it still adds some protection, and that's the key thing. As we've talked about with the COVID-19 vaccines, we're not talking about getting to 100%. We never get to 100% when it comes to vaccination. Even if it's only a 30% match or something along those lines, it still will afford some protection and decrease the amount of virus that's circulating in our communities, whether we're talking about influenza or COVID. And that's the important distinction there. We want to decrease the amount of virus circulating, and therefore it puts everyone else at a less of a risk for contracting the virus in the first place. And so, but yes, adding a strain of having influenza. Last year when we had our peak for COVID-19, we had almost no influenza in the state of Maine. Having both of them circulating at the same time will cause us to have problems. So thank you for the ability to talk about that.
Thank you for those questions, Owen. Patty White from MPBN, you're up next.
Thanks very much. And Dr. Jarvis, you talked about monoclonal antibodies at the beginning, about how only one kind is really effective against Omicron. What's that supply like here for you? Do you have enough of that particular kind of monoclonal antibody? Can you just tell us a little bit more about that, situation?
That's a great question, Patty. So that monoclonal antibody is sotrovimab. Unfortunately, in the state of Maine, that supply is short. What's positive right now is that since we're mostly dealing with Delta at this point, we can use the two other monoclonal antibodies in order to treat patients now, but we know that's only going to be a matter of time before that shifts and changes. The federal government announced yesterday that they are going to change the supply chain for sotrovimab, and we expect that there will be changes there, and we'll be hearing more in the coming days to weeks on how that supply chain will affect. Right now, they're going to look at areas where there is high prevalence of the Omicron variant and make sure that they have adequate supplies. And if and when that happens here in Maine, I am hopeful that we will be able to get an adequate supply. But it just once again makes that point. You shouldn't be relying on things like monoclonal antibodies. You don't want to get sick in the first place. And so vaccination is the way to prevent getting sick, so you don't have to worry about what our supply for monoclonal antibodies are. So once again, another plug for the importance of prevention over treatment.
And you talked a little bit last week about the limited supply of monoclonal antibodies, just even the kind that is effective against Delta. Just tell us, do you have an adequate supply of that right now?
Supplies are certainly limited, and we know that there are some individuals who are on, kind of at the bottom list of what we think should be prioritized for getting monoclonal antibodies, who we may at a particular day might have to have them wait a day or so before they get that particular treatment. Northern Light Health has been able to manage most of the individuals who we consider at high risk if they were to get a positive test for COVID-19 to be able to offer them monoclonal antibodies, but it's a very tenuous situation. And like I said, there may be some days where we can't meet that goal and need to postpone people for a day or so. And it really is a moving target. We've done very well in the state of Maine, but it's not going to take much before we're not going to be able to even keep up with that demand.
Thank you very much for those questions, Patty. Next up, we're going to go to Eric Russell from Portland Press Herald.
Thank you, Chris and Dr. Jarvis and Paul. Question I had to do with hospital capacity. Can you give me a sense of how long COVID patients have been staying in the hospital and whether you've seen any changes with that? I know we get updates every day about the current number of hospitalizations, but I think what's missing in that sometimes is how long, how many of those are the same patient day after day after day. So can you give me some sense of how long people are staying in the hospital on average, and is it longer than it had been, or shorter, or the same?
Yeah, that's a great question. Again, when we talk about some issues, we talk about, the 70 patients we're caring for as a large number, and it certainly is. We wish we weren't taking any care of anybody that was positive for COVID-19. But from a statistical standpoint, that's still a relatively small number. What I have been seeing from a trend really since about October, but significantly since the beginning of December, is an increase in the length of stay that these particular individuals are staying in our hospitals for. It used to be the majority were certainly under 5 days, many of them only needing to spend a night or two in the hospital. Now the majority of the patients are spending 5 days or longer. And of course, we've had patients that have spent weeks to months under our care. The other thing to remember is that when we talk about that number of 70, that means that we're still treating them for COVID-related incidents. We still have patients that were initially admitted for COVID reasons who have recovered from the COVID side of things, but are still not ready to go home due to deconditioning or some other ailment that keeps them in the hospital. And so that actually, makes it so the length of stay is even longer than the length of stay that we're just talking about for COVID. This is a serious illness, and so people who are hospitalized tend to spend much longer in the hospital than they would, say, if we were treating them for other respiratory conditions, including usual admissions for influenza or for pneumonia. So great opportunity for us to share that, yes, indeed, many of these individuals have been here for a prolonged period of time, and in fact, some people have been here for months.
Thank you. The next question I had to do with, so there's been some help offered to hospitals through the form of National Guard members, and there's going to be some additional federal help with the ambulance crews. What's the next contingency if those aren't kind of meeting the demand that you're seeing? Is there a next step? I know I hate to be doom and gloom, but as we think about people gathering over the holidays and everybody's sort of under the assumption that things are going to get worse, what's kind of the next step that you guys would take as a system?
Yeah, unfortunately, I'm going to say that there is not a whole lot of next steps. People have said, well, why aren't we activating National Guard members who have clinical experience to play clinical roles? Well, the fact of the matter is most of them are already employed at our hospitals, and so if we were to activate them, they would just be the same staff, so it doesn't have any increase in numbers. It just changes, what their status is whether they're a civilian or on active duty. And so there is little help there. There is some other resources that the state can look for in terms of individuals who have recently retired, have kept their skill set up, or may no longer be in healthcare but want to come back and assist. We have used a lot of those opportunities already for us as we look at the things that we've done for our vaccination clinics and the volunteers that we have. I will say, and I'm proud to say that Paul has done this as well, we have started to train non-clinical personnel in abilities to do some clinical activities, including administer vaccines. And I'm proud of the fact that Paul was able to train in that and has been actually administer vaccines at our booster clinic. That's what we're doing now. We're literally training on the job for things that don't require the same level of education that, say, a nurse or a physician needs to have. And doing the best we can. But there is not a lot of reserve out there, nor is there a lot of opportunity for us to get travelers, either as physicians or nurses, to come in and fill clinical roles. Every place in the nation is suffering from the same thing that we're suffering from here in Maine, and therefore our healthcare system across the United States, but particularly here in Maine, is extremely strained and very fragile. So thanks for the opportunity to talk about that. Paul, anything in addition to that?
I think you covered it well, Dr. Jarvis. The key really is, our staff have proven to be a very resilient group. We're tremendously proud of our staff, but giving them the supports that they need and making sure that we're doing what we can to let everyone work at the top of their license. So if we can train administrative staff to administer vaccine and supervise them appropriately, and that frees up nurses and others to provide more high-level patient care up to their license level, then that's exactly what we need to do, and that's what we are doing. And so it's those creative ways of approaching things that are traditionally done differently are how we're doing it. We're trying to be creative, but as Dr. Jarvis said, options are limited, and so we need the help of the community to mask, to become vaccinated, and to distance, do all the things we've been talking about for about 2 years now, will greatly help our ability as a community to weather this current surge.
Thank you very much for those questions, Eric. Next up, Chris Costa from New Center, Maine. You should be able to unmute and ask your questions, Chris.
Hi, everybody. Thanks so much for taking the questions. My first question is for Dr. Jarvis. Dr. Jarvis, pardon my ignorance on this front, but I was just trying to figure out, I know that we've talked a lot about needing to transport patients in between hospitals that need higher level care. Can you kind of explain what hospitals in the Northern Light Health System are able to do what types of treatment for COVID-19? And I guess knowing that EMMC is one of the state's 3 trauma centers, right? So is EMMC kind of the highest level of, not highest level, but the highest magnitude of care that a patient might need to receive, like an ICU or something like that? I want to understand more about how that works.
Yeah, so for hospitals, there's definitely a large variability between what hospitals can provide, and so at our smaller critical access hospitals, they can provide the basic care for somebody who has COVID-19. Many times they can provide at least a modicum of intensive care for at least a short period of time, and that means more intense nursing care, maybe even ventilatory support. We do have a system where we do provide telehealth services to our smaller hospitals so that providers there can get information and advice from experts in critical care. Then we have some of our smaller hospitals that have the capability of doing intensive care and taking care of more intensive care patients for a longer period of time. A.R. Gould, Maine Coast Hospital, Mercy Hospital. And then, of course, you have Eastern Maine Medical Center as a flagship medical center, which has the ability to do tertiary care and not only provide long-term critical care for patients, but more specialized critical care and certainly services that smaller hospitals can't do, such as cardiac care, care for trauma patients like you mentioned. And that's part of the issue that we're having, is that our trauma centers are now being filled up with patients that are really being treated for more medical things. It doesn't allow them to be open for certain trauma services, certain cardiac services, and that's really what our fear is that we won't be able to take care of those things that day in and day out we really don't make the news, but that are so important to families and individuals because it's literally life-saving care that can only be done at a major medical center. And if they're filled with patients who are being cared for other reasons like COVID-19, that means there are fewer beds available, fewer staff available to take care of those things. And that's the precipice that we're on. We have seen around the state that at varying times, each of the medical centers has had to curtail some kind of service or another, some a little bit more, some a little bit less. We've been fortunate at Eastern Maine Medical Center. We haven't had to do that very often, and even today continue to be able to provide a lot of our procedural services, even though others in the state are not. But it is a very precarious situation, and any more stress to the system will make it so that we may not be here when you need us for things like heart attacks, traumas, care for your diabetes. Safely delivering a baby in a safe hospital setting. We're just at that situation.
Yeah, understood. I could sense definitely emotion in your opening statement. I don't know if it was frustration or desperation or maybe a combination of both, but certainly understand that. My second question, I don't want this to sound too repetitive, but I do know that with things always changing and the new variant, there are new questions, especially for parents. A lot of young kids, especially those under the age of 5, as we get up to these holiday gatherings, these parents are concerned about my child who cannot get a vaccine yet. Yes, maybe the adults in the house, maybe even the kids 5 and older may be vaccinated, but what should parents be on the lookout for those young kids who cannot get the vaccine? How can they protect them? Would it be just kind of the things you already mentioned? Should every adult, even if they're fully vaccinated, still wear a mask around a kid who is too young to get the shot?
Yeah, Chris, absolutely. You're spot on. Making sure that you're continuing to do all those things, which is why we're talking about, if you have multiple households gathering together, wearing masks is actually the most appropriate thing you can do, particularly when there's young children or people who may be at risk for not having great immunity to the vaccine. Unfortunately, right now, the data is not clear as to what the effects of Omicron will be on children, and we'll know that as time comes, because they will certainly be exposed to the virus as everybody else will be, as we see numbers continue to climb. Yesterday, a report from the federal CDC was that they just don't have enough data to talk about what this impact will have on children. But even if they just have a cold, that still impacts, right? That means they can't go to school. It means they can't visit grandma. It means that it affects everybody within that household if a child was to become positive for COVID. So again, prevention is our best efforts. So protect everybody who can't be vaccinated, or if they were vaccinated, might have a weakened immune system, by everybody else who can be vaccinated being vaccinated, wearing your mask, staying socially distanced, and washing your hands as frequently as possible. And sometimes, unfortunately, it's going to mean avoiding in certain gatherings, and we know that's hard during this time, but it may be the best thing for a family. You'd rather miss the celebration of Christmas than to be gathering later on for a funeral. And I hate to be so blunt on that, but that's the reality of what we're dealing with right now.
Okay, thank you for your questions, Chris. David Marino, Bangor Daily News. Please feel free to ask your questions.
Thanks, Chris. Dr. Jarvis, the Portland area is seeing far lower overall case rate than in Bangor. York County is a little higher than Cumberland, but York is still lower than Penobscot. Are there any indications of why Maine Medical is having so much more trouble, it seems, in Eastern Maine Medical Center? I know you were both in a precarious kind of situation, but it seems like Maine Medical, and you've acknowledged this in previous conferences, is just having probably the hardest time in the whole state. Why does it seem like they're seeing it the worst? Is it a case of absolute case numbers being more important than relative ones?
So I think some of it has to do with the differences in the way the two hospitals are set up, and and there's good reasons why they're set up a little bit differently. And so it has taken a little bit more effort on the part of our colleagues down at the Maine Medical Center to reorient themselves and to be able to take care of the intensive care unit patients that they have. They do serve a bigger population than certainly Eastern Maine Medical Center does, and they do have some specialty care that Eastern Maine Medical Center does not have, and so it's not uncommon for Eastern Maine Medical Center to have a patient go down to Maine Med for care in a particular situation. So there's a little bit subtle differences there. But I think the reason why we're seeing different case counts, though, is still in some of the southern and western portions of the state, there still is some high numbers of patients that are positive, and therefore they do tend to flow into the Maine Health System, and therefore to Maine Medical Center, versus Northern Light Health, where our geographic area is spread out and our hospital makeup is a little bit different than Maine Health's hospital makeup. And again, I am so proud of the fact that our smaller institutions have learned how to take care of many patients with COVID-19 as well as other conditions, and being able to keep those patients closer to home. And that has freed up beds at Eastern Maine Medical Center because we're able to do that. I'm not so sure how long we'll be able to keep the pace that we are and still maintain all of the services. I just think it's possible that Maine Med is just a little bit ahead of where maybe the situation will be at Eastern Maine Medical Center. That's just where we're at.
It's a really worrisome thought. Is there any indication to you that there has been an increase in first dose vaccines? I've heard a lot about clinics, giving out a lot of boosters, and I know that boosters are very important, but it seems to me that this problem is very much motivated by lack of people getting first dose vaccines. Is there any indication to you that those are growing in Maine right now, given Omicron?
They are. Certainly not to the level that we saw, obviously, during the spring when we were trying to vaccinate in very, very high numbers. But all of our vaccination sites have continued to do primary vaccine series. We continue to see that. We also have people that age in, right? We have children that now, that turn 5, and so they are now eligible for vaccine, and so we're seeing some of that as well. And so yes, we continue to provide first dose vaccines, and without judgment, without question, we will just go ahead and do that. As long as there's somebody who wants to be vaccinated, we are here to vaccinate.
David, thank you for your questions. Next up, we're going to go to Rebecca Alley from Ellsworth American.
Yes, hi. Thank you all for your time. I just have one question. With the Omicron variant posing a risk for more breakthrough cases and hospital staffing and capacity already stretched, is there any data that would support changing the 10-day quarantine guidelines for vaccinated healthcare workers who become infected so that they can return to work if they are symptom-free?
Yeah, so I think it's a little bit still too early to tell. We do know that the CDC is going to update their guidance both in terms of what healthcare agencies should be doing as well as what the general public is doing, and we're waiting for some of that guidance. I think it's just too early to tell. Most of the information that we're getting that we can kind of compare to here in the United States is coming out of the United Kingdom. Again, it's only been a few weeks that they have started to see their surge, and so we will learn a lot from that. And I think you may see some changes that come forward. As far as requirements for boosters, that's a different conversation altogether, and certainly not one that I'm comfortable answering questions about right now.
Thank you, Rebecca. Next up, we're going to go to WGME, Brad Rogers.
Oh, hi. Yes, I was just curious about the wait times for EMTs right now in ambulance and transports. Are there some wait times there at the hospitals right now, and how long are they, and what's the impact to the hospitals because of that?
Yeah, so really it's not the impact to the hospitals, it's the impact to the person that needs those services. That's the concern. And we certainly continue to hear stories of the delay in transport services because transport is so busy. From a hospital standpoint, for us, it's usually more transport out of the hospital and going to some other level of care that has been problematic for us on a global front. And so those are things that certainly hamper our ability. And in fact, that's really what the ambulance service from the federal government will hopefully be able to provide for us, is being able to transport somebody, say, from out of an acute care setting into a long-term care or a skilled nursing facility, which again, even if that saves an hour's worth of time, that's another hour that we have to bring another patient in. And so that's really where we're seeing our resources. I don't know, Paul, if you had anything in addition to that.
No, I think you touched it well, Dr. Jarvis.
Thank you.
All right. Thanks so much. Appreciate it.
Mm-hmm.
Thank you.
Okay, thank you, Brad. We're going to move on now to Blake Lipton from Fox Bangor and TV7.
Yeah, thanks, Dr. Jarvis. In terms of patient population now of those that are hospitalized, are we seeing sort of the same kinds of people that are needing treatment in the hospital for COVID-19, like whether they're older, unvaccinated, or, is there a specific age range that's kind of jumping out at you right now?
Yeah, so again, as we've said, we certainly are seeing some breakthrough cases, but the majority of cases that require hospitalization are in unvaccinated individuals. I guess for me, the concern is to seeing the number of people between the ages of 20 and 50 who are requiring those hospitalizations. I think that's the age category that often feels that they're invulnerable and they don't have to worry about these things. Well, they do need to worry about it. We are seeing that age category making up a significant portion of the individuals not only who require hospitalizations, but the individuals who are requiring intensive care. And that's a concern. The other concern for me has been the number of women who are pregnant who have contracted COVID-19 who have required our services, including emergent deliveries of their baby and intensive care. That's incredibly concerning. And again, there's a way to protect them and protect their baby, and that's to be vaccinated. And so we strongly encourage that all women who are pregnant or planning on getting pregnant to get vaccinated, and also everybody that surrounds them, the people that are in their household, the people that they work with, the communities that they live in, because again, that makes it that much likely that the virus is out there and those individuals get it. I mean, we don't want to start hearing stories of us, losing both a mother and child in a short amount of time from a disease that can be prevented with vaccination. So thank you again for the opportunity to say that.
Hey, Blake, just want to check to see if you have a follow-up, or are you all set?
Yeah, one follow-up, and I'm not really sure where this will go, but I thought it's worth asking. In talking with some people, it seems like some folks have lately, as the Omicron variant has kind of ramped up a little bit, some people I've spoken with have taken rapid tests that have said they were negative, but then they've taken PCR tests that said they were positive. Is there, have you guys heard of anything or seen anything where Omicron is maybe more detected in PCR tests as opposed to rapid tests? Or is that just, a thing sometimes where the rapid tests don't catch them at the right time?
Yeah, it's actually a factor of the fact that the rapid tests are not as sensitive as the PCR tests or some of the other nucleic acid assays that we utilize. And so there always is that chance that there's both either a false negative or a false positive with those tests. It's why oftentimes we're talking about people who have had an exposure to COVID-19, that one test is not enough when you're doing those rapid tests. You need to do serial testing. in order to catch it. The other thing too is just the incubation period. The incubation period for Delta, which again is the predominant strain here, is somewhere between 3 and 5 days. It looks like the incubation period for Omicron is less than that. So you may see that somebody is negative one day and then the very next day they're positive because Omicron replicates that fast. But it is one of those things that we are a little bit concerned about reliance totally on rapid tests, because simply if that's the case, we are going to miss some people who have a positive result, but the test itself comes back negative. So.
Thank you for your questions, Blake. I know we ran a little bit long, but last but not least, we have Talia Clark from WMTW. Talia, you should be able to ask your questions.
Hello, Dr. Jarvis. So I just have a question about the FEMA ambulance teams. How many people are coming to help Northern Light Health Hospitals specifically as part of that?
I don't think I have a specific answer. I don't know, Paul, if you do.
My understanding is there are 2 people. It's an ambulance driver as well as a paramedic and the ambulance itself. And that will be located at EMMC, transporting patients for COVID transport to and from EMMC, as well as being able to assist in the emergency department at times when they're not on a transport.
And one more question, thank you for that. But one more question, roughly how many people have been treated with the monoclonal antibody treatment, and how does someone qualify for that sort of treatment?
I'm just trying to look at my numbers here to see if I have an exact number for you on how many. I don't think that I do. We can try to get that information for you. Truthfully, first of all, it has to be somebody who has a positive test. They have to have mild to moderate symptoms. This is not for people who are severely ill that need to be hospitalized. And then it is that they have risk factors for severe disease, with the number one risk factor being age over 65. And so for qualifications wise, I will say that Northern Light Health, if you've had your test done through a Northern Light Health entity, those are reviewed by our Beacon Healthcare management team, and they do go through and risk stratify those patients and notify patients if they feel that they are eligible. And also the individual's provider can certainly reach out to Northern Light Health if they have a particular individual who they think qualify. And so that's how that happens.
Okay, well, I'm going to thank all the members of the media for your time today. Yep.
Chris, I don't know if you've kept on the chat, but as we've had this briefing, the news did break. The FDA is authorizing Pfizer oral antiviral pill. It just happened just now. Dr. Jarvis, I don't know, do you want to provide any? Do we have any comment that we can provide?
Other than we are grateful for any tool that we can use to help combat this particular disease. We know that the data from the Pfizer antiviral medication looked good, at least in comparison maybe to monoclonal antibodies. And a little bit safety profile compared to the Merck one that we had expected to already be in the state. It's going to we'll know in the coming days as to what the supply looks like and how that will be administered across Maine. It's not something that's currently available though.
Okay. Well, thank you all very much for your time today. Have a great rest of your day, and stay safe out there on the roads. And thank you.
Thank you very much.
Paul?
Thank you very much, all.